I want to reinforce the Prime Minister's observations about the focus we have had since the onset of the pandemic on our close partnerships, our work with our Pacific family on their priorities in terms of COVID-19 response. Firstly, the pivoting of our development assistance program in Partnerships for Recovery. Importantly, our bilateral COVID-19 response plans, and most recently our vaccine commitments in relation to the Pacific and of course Southeast Asia. With the Papua New Guinea government in addressing these issues, we have been engaging regularly and in depth with senior leaders. The Prime Minister with his counterpart, Prime Minister Marise Payne. I've been speaking with Health Minister Jelta Wong, both personally and regularly by message in terms of updates on their response actions. And that engagement has taken place across the Australian government as well. Our High Commission in Port Moresby is participating in Papua New Guinea's COVID-19 technical working group and attending meetings at the most senior levels with the High Commissioner and his senior councillor staff. Our Indo-Pacific Centre for Health Security is coordinating our health security response in the region, including with Papua New Guinea. I really want to emphasise that the work that we are doing and the work we are announcing today is in partnership with Papua New Guinea, based on their priorities and their needs. And we have identified those 4 very immediate measures that the Prime Minister has spoken about in terms of the vaccine response and a number of other supplies, tents, PPE, and the AUSMAT team. The AUSMAT team, which will be in country on Monday next week, we expect will also do the groundwork for the clinical response team, which will follow them. The 8,000 doses of vaccines that we have referred to this morning will fill a critical gap in advance of Papua New Guinea's receipt of its vaccines from the COVAX facility. They are expected in Papua New Guinea in April and then further doses in May. So this gap for frontline workers will be absolutely essential for those people to be able to continue to do the job that they are doing. We are also providing Papua New Guinea, through the vaccine program we have announced, $144 million to support their PNG vaccine program and its rollout. The Prime Minister's referred to the Torres Strait. We're obviously dealing with very close family and cultural connections between those traditional inhabitants of the villages within the Torres Strait protected zone, and therefore paying particular attention to the needs of those treaty villages. I want to acknowledge our colleague Warren Ench, the member for Leichhardt, who has been fundamental in engaging with communities in the region, engaging with leadership in the region, and being very clear about their concerns and their needs. I also want to again acknowledge the Queensland health system for their undertaking and their engagement with us on addressing these issues in the Torres Strait. This will need to be a shared vaccination effort. These measures that we're announcing today fit well with the carefully coordinated approach that we are taking with other partners. First and foremost, in this case, our partnership with the Papua New Guinea government, but also our other international partners, including as recently the Quad leaders meeting undertaking on vaccines from last Saturday with Australia, India, Japan and the United States. Under the agreement that was made at the Quad leaders meeting, our 4 democracies have set out a very ambitious but very practical and positive agenda on COVID-19 vaccines. That includes an increased $100 million contribution from Australia on top of the over $500 million contribution we announced last year, and as the Prime Minister referred to, our support to the COVAX facility. In Papua New Guinea, that will mean working with Japan, with India and with the United States in relation to what support we can provide together, whether that is technical support, whether that is work through UNICEF, who is one of our key partners in the delivery of vaccines in the region. Those conversations have started, and we will continue those through the Centre for Regional Health Security and other officials with our Quad partners.